Welcome back to Dr. Grandpa, your trusted health tips grandpa's wisdom. If walking feels harder than it used to, if you worry about balance, falls, or weak legs, this video is for you. After 60, walking problems don't come from age alone. They come from specific muscles, quietly getting weaker muscles most people never train. Many people believe walking becomes difficult simply because of age. But the truth is, walking problems usually come from muscle weakness, joint stiffness, and balance loss, not aging itself. When the right muscles are trained, walking can improve at any age. Walking safely depends on the hips, thighs, calves, core, and ankles working together. When even one of these areas weakens, steps become shorter, slower, and less stable, raising the risk of falls. Most falls don't happen suddenly. They begin with weak leg muscles that can't react fast enough. Strengthening these muscles improves reaction time and stability, reducing fall risk significantly. Balance is a skill, not a gift. After 60, balance declines if it isn't practiced regularly. Simple balance exercises retrain the nervous system and help the brain communicate better with the legs. Slower walking speed is not just inconvenience, it's a health signal. Research shows slower walkers have higher fall risk and reduced independence. Did you know walking speed improves with the right exercises? Fear makes people take shorter, stiffer steps. This actually increases fall risk. Strength and balance exercises restore confidence, allowing the body to move naturally again. Supportive shoes help, but they don't strengthen muscles. Without exercise, the legs continue to weaken. Real safety comes from strong muscles, flexible joints, and good balance, not footwear alone. Walking is great, but it doesn't fully strengthen the muscles needed for stability. Specific exercises target muscles. Walking alone doesn't activate enough, especially after 60. Muscles respond to training at any age. Even after 70 or 10, strength and balance can improve. The body is far more adaptable than most people believe. In the next part of this video, I'll guide you through the 5 most important exercises that help you walk stronger and safer step by step at your own pace. Si tu stand strengthens the thighs, hips, and core, the same muscles used in walking, climbing stairs, and getting up safely. Weakness here is one of the biggest causes of falls after 60. This movement activates the quadriceps, glutes, hamstrings, and core muscles together. Training them as a team improves coordination, balance, and walking confidence. Use a sturdy chair without wheels. Sit tall, feet flat on the floor, shoulder width apart. Keep your chest lifted and eyes forward to protect your spine and balance. Lean slightly forward from the hips, press through your heels, and stand up slowly. Avoid using your hands if possible. Control the movement, no rushing. Lower yourself back into the chair slowly. This controlled descent strengthens muscles and improves balance. Never drop down. Quickly control builds strength and safety. Begin with 5 to 8 repetitions. Rest if needed. Quality matters more than quantity. As strength improves, gradually increase to 10 to 15 repetitions. If you feel pain, use a higher chair or lightly push from the armrests. The goal is comfort and safety. Pain is a signal to adjust, not to quit. Avoid rounding your back, locking your knees, or standing too fast. These mistakes reduce effectiveness and increase injury risk. Slow, controlled movement is key. Stronger legs mean longer steps, better balance, and quicker reactions. Many people notice improved walking within just a few weeks of practicing this exercise regularly. Practice sit-to-stand at least 3 5-day PRU week. It takes only a few minutes and delivers powerful results for walking safety and independence. Ankles control balance with every step you take. Weak ankle muscles reduce stability and increase the risk of falls. Strengthening them helps you react faster when you stumble or step on uneven surfaces. Heel raises target the calf muscles and small stabilizers around the ankle. These muscles support posture, push-off, strength, and balance during walking. Stand tall behind a chair or near a wall. Place feet hip-width apart and lightly hold for balance. Keep your posture upright and relaxed. Slowly lift your heels off the floor, rising onto the balls of your feet. Pause briefly at the top, then lower your heels back down with control. You don't need to rise high. Focus on smooth, controlled movement. Even small lifts strengthen the ankles when done correctly and consistently. Start with 8 to 10 repetitions. Rest if needed. As strength improves, increase to 15 to 20 repetitions. Quality always comes before quantity. If balance feels challenging, keep both hands on the chair or wall. Safety always comes first. With time, balance will improve naturally. Avoid rocking, bending knees excessively, or moving too fast. These mistakes reduce effectiveness and increase risk. Slow and steady builds strength safely. Stronger ankles improve push-off power, balance reactions, and stability. Many people notice fewer stumbles and greater walking confidence within weeks. Heel raises can be done daily. They take only a few minutes and deliver big benefits for balance and walking safety. Marching in place mimics the walking motion while allowing full control. It strengthens the hips and legs, improves coordination, and trains balance in a safe, stationary position. This exercise activates the hip flexors, glutes, core, and stabilizing leg muscles. These muscles lift the legs and control each step while walking. Stand tall behind a chair or next to a counter. Keep feet hip-width apart and lightly hold for balance. Engage your core and relax your shoulders. Slowly lift one knee toward hip height, then lower it with control. Alternate legs at a steady pace. Focus on smooth movement, not speed. You don't need to lift the knee high. Even small controlled lifts strengthen balance and coordination. Comfort and control are more important than range. Start with 30 to 60 seconds. Rest if needed. Gradually work up to 1 to 2 minutes as balance and strength improve. Use both hands on the chair if needed. As balance improves, reduce support gradually. Safety always comes before progression. Avoid rushing, leaning back, or holding your breath. These habits reduce effectiveness and increase fall risk. Stay upright and breathe naturally. Marching improves leg lift, step timing, and balance reactions. Many people notice better stride confidence and fewer foot stumbles after regular practice. Marching can be done daily or as part of a warm-up before walking. Just a few minutes helps keep the walking pattern strong and safe. Side-to-side stability is essential for safe walking. Weak hip muscles make it harder to recover balance when bumped or stepping sideways. Side leg raises strengthen the hip abductors and glute muscles. These muscles keep the pelvis level and prevent wobbling while walking. Stand beside a chair or counter. Hold lightly for support. Keep your standing leg slightly bent and posture tall. Slowly lift one leg out to the side without leaning. Keep toes facing forward. Lower the leg back down with control. You don't need to lift the leg high. Small controlled movements activate the right muscles and protect the joints. Start with 8 to 10 repetitions on each side. Rest between sides. Gradually increase to 15 repetitions as strength improves. Use both hands for support if needed. Over time, reduce support as balance improves. Progress slowly and safely. Avoid leaning, swinging the leg, or pointing toes outward. These mistakes reduce effectiveness and strain the hips. Stronger side hips help you recover when pushed or stepping unexpectedly. This exercise greatly reduces sideways fall risk. Practice this exercise 3-5 days, PR week. It fits easily into any walking or balance routine. Sit-to-stand trains the exact movement required for independence. Weak legs make standing difficult and increase fall risk. Strength here supports safer walking everywhere. This movement strengthens the thighs, glutes, hips, and core. These muscles generate power for walking, climbing stairs, and maintaining balance. Use a sturdy chair placed against a wall. Sit near the front edge with feet flat and hip width apart. Safety begins with proper setup. Lean slightly forward, press through your heels, and stand up tall. Sit back down slowly with control. Avoid dropping into the chair. If standing is difficult, lightly push off the armrests. As strength improves, reduce hand support gradually. Start with 5 to 8 repetitions. Rest as needed. Gradually work up to 10 to 15 repetitions. Strength grows with consistency, not speed. Avoid rushing, locking knees, or leaning too far forward. These mistakes reduce effectiveness and increase joint strain. Stronger legs make walking smoother and less tiring. Many people notice longer walking distances and better posture within weeks. Sit-to-stand can be practiced daily. Even a few repetitions per day dramatically improve functional strength over time. Stop if you feel pain, dizziness, or shortness of breath. Always listen to your body. Progress slowly and safely.